Non-stop news and weather on 9 on your side at 11.
Hello and happy Wednesday. Congratulations, you made it to Hump Day.
How about that? Hey, we got a whole lot of history and fun for you on Cincy Lifestyle.
How well are your kids brushing their teeth? When should you start them? We have our favorite dental hygienist in the studio today to answer all sorts of questions about those baby pearly whites.
Mona?
Thank you. Okay, getting a toddler or even older children to do something that can really be difficult, especially when it's a task they don't enjoy. But brushing their teeth doesn't have to turn into a wrestling match. Dental hygiene can be fun, but parents need to know the basics. I want to welcome back our retired dental hygienist, Louise Goodman. So great to see you again, Louise.
Thank you again.
We love having you here. All right, tell us first about children and why, about their teeth and how they should care, parents should care for their children's teeth.
Okay, well, first of all, they start developing teeth they start erupting around 6 months, which is average, till 2 years of age. And a lot of times parents wonder how many teeth are they supposed to get. So the easiest way for a parent to remember how many teeth is think about your fingers and your toes. You have as many teeth on the upper as you have 10 fingers, and you have as many teeth on the lower as you have 10 toes. So, and that comes to 20. So when you can count 20, you know they've got their whole set of teeth.
Oh, great.
And teeth erupt not in an ABC order. They go out of order, but yet they're identified from A to T. So bottom teeth usually come in first around 6 months, and that's usually P and O or O and P, and then upper teeth, which are E and F.
Okay, wow, this is so enjoyable. Okay, so tell us, how do you care for baby's teeth or infant's teeth?
You know, baby's teeth are just like our teeth. They're just a little bit smaller, and I always say teeth are like dishes. And if you're going to eat off of a plate, whether it's a big plate or a little plate, and you don't wash it, you're going to end up with, for adults, you're going to end up with what we call tartar. But what's real important, for kids, we're going to end up with what we call plaque. And plaque is the beginning, is what causes your cavities. So it's extremely important for parents, grandparents, and caregivers to take care of the teeth. And what I recommend is every time that child, and now we're going to talk from birth to a year, and they have changed, the American Pediatric Association has changed, and actually recommend that kids don't even have solid food till 1 year. But even if they were on formula and breast milk for 6 months, they're still going to have a buildup. So I recommend buying, these are called 2x2 squares, they're called squares, or you can take a baby washcloth, cut it in 4, you make yourself 4 toothbrushes that way, or you can get a substantial paper towel. But you don't want to use a tissue because once you wet it, it will, you know, break down in their mouth. So what you want to do, and since I didn't have a friend who had a little set of baby teeth. These are actually my son, who's 37, his baby teeth.
Oh, wow.
Which I had made into a denture. So you can see how little the teeth are. But what you want to do is you want to wet this, you want to squeeze out the excess water, and just wipe the teeth off in the front and the back. If you don't do that, they're going to get red gums, red swollen gums, because they have all of this stuff on there. Or even, like I said, if it's breast milk or formula, it still has sugar in it. Natural sugar as compared to refined. So you want to make sure every night, or not every night, every time you put them to bed, which can be 4 or 5 times a day, that you wipe their teeth down.
Okay, so tell me about the liquids, snacks that are good for them or aren't good for them.
Okay. Everything has sugar in it.
Yes,
and if you look at everything, I mean, we'd have to be fed with an IV to avoid going through our mouth.
Right.
Okay, we can get our calories, but we won't enjoy them. But our teeth will be clean. That's an impossibility. So what you want to do for kids of all ages, and I don't recommend starting before they're toddlers with any of this stuff, but you want to stay away from anything that's going to be in their mouth, like a sucker, or the mints you get free, which cost you in the long run because of the decay. You want to stay away from anything that stays in their mouth more than 10 to 15 seconds, because the longer it's in their mouth, mixing with their saliva, and they probably have eaten during the day something, that's when you get your plaque, which is all your bacteria, with your saliva making the acid, and that's what causes tooth decay.
Okay, we just have 2 seconds left. Tell us, at what age should they start seeing a dentist?
The American Academy of Pediatrics does recommend it 1 year, and that's to come in and look and see and make the child comfortable. If you miss that 1 year, 2 years, don't panic. Their teeth are not going to fall out. As you wipe them or use a baby brush to brush them, you can see if they're getting decay. Okay. And most of the time it will start along the gum line, whether it's upper or lower, or a brown spot on the chewing surface. My office that I was at for 30 years, we started them around 2.5. And some at 2.5 were wonderful, and some at 5.5 weren't.
Well, Louise, it's always a pleasure and fun to have you on. Thank you so much for being here.
You're so welcome.
All right, we appreciate it. Clyde?
Absolutely love it, Mona. Thanks.